Great. So as we are live on YouTube and on Facebook, just going to share it in a couple of places before we actually get it kicked off. And while I'm doing this, if you are already hopping on here with us, give us a thumbs up. Let us know that you can see us, hear us, are excited for this content, so I can give you some love and shout out. Perfect. So it looks like we've got a few people that are already tuned in. I'm just going to go ahead and start displaying some of our comments as we get them through. Good morning to Councillor DeMont. I see Wayne Anderson with us and a few other folks that are watching. Don't know who you are, so make sure you comment or give me that thumbs up so I can give you that shout out. Good morning to everybody. And as you all are aware by now, I'm Juliette Abdel, President and CEO of the Westminster Chamber of Commerce. And if this is your first time here, hit that like button, hit the follow. And if you've already been on here before, only like our page, but don't get the timely updates when we are on here. Make sure that you're following the page so you can get those notifications. I wanted to go ahead and basically just give a framework of our videos. As many of you are aware, these live broadcasts were brought to you back in March to help people adapt to COVID as a business owner, what resources you might need. These have morphed into still resource-driven and education-driven, but we have with us our mayor every Monday that kicks it off all the way to our electeds and city, county, and state administration, rounding out the Fridays or the end of the week. In between, we're able to display our business success series, which we've done just yesterday with Zimmer Biomet. If you did not catch that, it's available to you on the video section of this video, of this webpage. We also have our nonprofit corner, which will feature tomorrow Jeffco Public Schools Foundation as well. So these videos are brought to you at 11 a.m. generally, unless I have any tech issues, on a daily basis. They're available to you to watch at any point in time, and even better, available to you to share to people that you know. They're here on Facebook. They're also on our YouTube page, but please also engage with us when you can on our other social media platforms, Instagram and Twitter at WestC Chamber. And of course, you can find a lot of our resources and information on the westminsterchamber.biz COVID-19 updates page. Now, you've already seen me start chiming in with these comments from Tina Francone on our board, all the way to Jerry, who's the Jeffco treasurer. Thank you for hopping on here with us. This feature I just wanted to show you along the way is available for anybody that's watching the video. So as you are listening to our experts and you think of a comment or question, or maybe you learn something and you're like, oh, this is a nugget of knowledge I'm going to take away, type it in. We like to know what you're seeing, what you're hearing and learning, but more importantly, we want to address any questions that you might have. So at the very end of the broadcast, we will take up comments or questions that are directed to both of our guests. So without further ado, I will go ahead and introduce our topic for today, which is really the Jeffco Public Health Department visiting with us on all things COVID, some educational information, and then they'll be available to answer some of the questions that may come to your mind. I have with us Christine Billings and Lakia Thomas, and both will share kind of who they are, what they do, and again, share information. Please make sure that you are giving us that thumbs up, commenting, so I know who's on here with us and give you that recognition as well. I see Jenny, Austin, Cheryl, several of you. Thank you for hopping on. Muting myself, ladies, you can take this away.
All right, good morning. Thanks, Juliette, for the introduction, and thanks to everyone for joining us this morning live in Jefferson County. This is pretty fun. This is the first time I've been in my office in a long time, and it was a clunky adventure getting out of the house, including trying to back up with my trunk still open. So hopefully I can do our presentation justice and not reflect my efforts in leaving my house this morning. So one of the things that I want to start with is just, in addition to the thank you for letting us join you, is sort of presenting a couple of tips and tools and tricks that we have available for the general public as well as our business partners. One of those, and a key one, is the COVID webpage that we have available on our Jefferson County Public Health site. One of the key pieces that we have is sort of this data dashboard. And I just want to point out a few really key pieces to this. There are 4 tabs that are available for you. One is case summary, we have demographics, we have testing, and we have geography. And all of those paint sort of a different but collaborative picture of the epidemiology of COVID-19 within Jefferson County. All of the data represented are representative of cases of COVID-19 in Jefferson County residents. So this is very much a picture of our local community. This first map here or dashboard points out our individual cases by report date and sort of their outcomes. So one of the activities that we get asked about in data points is who's still potentially infectious out in the community. So we use a algorithm, and if you hover over this infectious button, it will sort of tell you well, it used to tell you, I'll have to fix that in the Tableau, what that infectious piece means. But any of these points, if you click on them, they will highlight them on the map, and you can see them without all of the background information. This 7-day moving average is really representative of what we are seeing kind of smoothed out. So you can see we saw a peak really early on, early April in the disease, and then we saw a subsequent peak coming and probably still rising, frankly, from about June 14th on. And I know we've received a lot of information about the Jefferson County variants and what's at risk related to that. And please know we are working hard on several mitigation activities related to the Jefferson County variants to the public health order. A lot of that has to do with testing and public information, the mask orders that are now in place. And we are dealing with a lot of testing data as well. So making sure that people have access to testing. It is important to point out that just because we are increasing the numbers of tests, we are not necessarily increasing the amount of positivity of those tests, which is out there. If you click on the testing tab of our data dashboard, you will get sort of a picture of the testing that is going on in the community. This red dashed line is the number that several models have told us we need to hit pretty consistently to make sure that we are testing an adequate amount of our population. As you can see from about that June 14th timeframe on, we are doing a pretty great job of hitting that testing number. The other important piece to keep in mind is that we are keeping a really good percent positive average of hovering just below that 5% mark, which is really what we want to see. Keeping a lot of tests going, but keeping that positivity rate right below 5%. I'm always happy we do have a webinar posted for the data dashboard that our epidemiologist did that went really in depth on the data dashboard and the information that's available. So please check that out if you have time. I'll make sure that Juliet gets the link to that. And I am now going to turn it over to Lakia, who will be presenting quite a bit of information on how to manage outbreaks within your business environment.
Thank you, Christine. So I'm going to briefly go over the before, the during, and the afters when it comes to exposures occurring in the workplace. So we're going to start with the befores. So I'll talk a little bit about what you need to do in terms of monitoring your symptoms. Make sure you're monitoring not only your symptoms, but you're monitoring your employee's symptoms. Symptoms, if an employee has been exposed, usually show up between 2 and 14 days after exposure. The symptoms would include fever. That would include a high fever or low fever, cough, shortness of breath, fatigue, body aches, runny nose, loss of smell or taste. And when we look at confirmed positives, I want to make sure I'm highlighting that, or you understand what a confirmed positive is. A confirmed positive is considered to be a person that has received a PCR test, and the test has yielded a positive result. We'll talk about probables. You'll hear the word probables, and these are people that are displaying symptoms but have not been tested or used an approved test. Okay, so there are a few screening tools that employers can use to help with prevention for when it comes to monitoring symptoms in the workplace. So there's a tool that we can share the resource a little bit later on CDPHE's website. It is a tool to help you monitor and document symptoms. Now, it focuses on the symptoms of fever, coughing, shortness of breath, runny nose, those that are evident. And it also allows for them to report symptoms that you may not see. So headaches, loss of smell or taste, dizziness, those types of symptoms. Please, please, please encourage your employees to stay home. This is one of the most important pieces of prevention, just because you have a lot of employees that want to go to work because they may not have the PTO, or they're just afraid of coming to the employer and saying, hey, I'm sick, and they may be retaliated against or they lose their job. I encourage you at this time to begin having conversations with your employees, providing them with education. Talk more about what PTO looks like for them, or even what it looks like for them to take off those 10 to 14 days that they have to be off. We know it's easier said than done, but please, please, please make sure you are giving them that encouragement as much as possible. As Christine talked about, we talked about face masks in the workplace. It doesn't have to be your industrial face mask that we are seeing out there right now. It could be a cloth face mask. You can get creative. There we go. Beautiful. That is beautiful. Cloth face mask. You don't have your aunts, your uncles, your mom make you a face mask, or go to the store. They are readily available. Please encourage that, especially when social distancing is not something that can happen right at that time, or you're going to be in contact with a person between 10 and 30 minutes in less than 6 feet. Okay. Then last, make sure you're disinfecting your surfaces. There is another resource out there that the EPA provides that is a running list that they do update frequently of chemicals that you can use to disinfect your surfaces and that are approved, okay? Make sure you are paying attention to the contact time on the bottle. This will tell you how long you need to leave it on the surface. Make sure you are disinfecting all the surfaces of those high traffic areas, as well as the frequently used surfaces, okay? This would include telephones. This would include co-worker areas. Please discourage your employees from using each other's work areas as much as possible as well, okay? All right. So look at your infrastructures is another press point that I want to highlight. You're going to have to change up some things of how you do things, okay? Looking at the use of PPE. Of course, we talked a little bit about face masks, but body coverings as well as gloves or even shoe coverings. Identify your high hazard areas, okay? Minimizing the distance at work. Alter the conditions, and this is where you partnering with your local public health agency comes into play. There is no black and white to this because every situation is very, very, very unique. Okay, so we have a number that we will display that you can contact us and we can talk through each situation with you. Okay. All right, employee education. We'll talk more about that. So education happens verbally and non-verbally. Some examples of ways you can educate your employees. Of course, you have your weekly meetings, making sure you're going through hand washing. You're making sure you go of the physical practices that need to happen, the social distancing. But you can also put up posters, okay? Posters that are very, very, very specific to what needs to happen. So you can put up somebody washing their hands. You can put up somebody disinfecting surfaces, but noting in there the steps on how to disinfect those surfaces. You can also highlight wearing your mask, proper ways to wear your mask. Then you can also educate them on how to notify your supervisor or who to notify. You can list names on these posters that you may put up. And it could list, you could designate a workplace person that will, that's your COVID coordinator for the workplace. You can get very, very creative. However you need to communicate that information to your employees, you can do that. Okay. So now we're going to talk more about what may happen during an exposure, what needs to be done during an exposure. So what happens on our end is we're notified through our database, and it says, you know, we have a case by the name of John Williams that has tested positive for COVID-19. What our case investigators do is we contact that case and we interview them with a few questions talking about their symptoms, anyone else they've been in contact with, and we will also get their employer information. Now with this information, we will contact the employers via email, and hopefully they have an email address. If they don't, we'll usually just get a contact number and contact them that way and provide guidance. So once we get that email, we'll send out a notification. On that notification, there will be a number. We can't send any personal health information through emails, anything like that, but we can have that conversation over the phone. So just also make sure as employers, you are aware of that. We will not share any information via email, but you can call us back with that number and say, hey, I've been notified that number 554683 tested positive. Can you tell me a little bit more or give me more information? From there, we can tell you who it is, and we will provide you with guidance. That guidance would include isolation and quarantine times. So anyone that has tested positive will get an isolation order of 10 days, with day 1 starting as their onset of symptoms. If they are probable, and that just means somebody exhibiting symptoms, but has not been tested, they get a 14-day quarantine time. So we'll discuss that on the phone call or via email. We'll focus on how to mitigate through the exposure, and we will give you the link for the screening log if you don't have it already, and we'll talk more about the symptom tracker. And so if this is used I'm losing my words. This is to report any symptoms through CDPHE, and it's just through text messaging. And you can say, hey, I'm experiencing symptoms, and they can notify whoever they need to notify and provide you with guidance on next steps of what to do as well. Now, if you are a workplace that has customers like retail spaces, we won't share any information with you if a customer has come in that is tested positive, that has reported to us that they're positive and they visited your location. All we can do is say, hey, there's been a possible exposure. This is what you need to do to help mitigate the situation. And you need to make sure you're identifying all employees, and this is for employees and customers, in those situations of customer or employee exposure, we need to identify those that were around that person for more than 10 to 30 minutes, within 6 feet. And then we'll go over quarantine and isolation protocols for that. Make sure, once again, last but not least, disinfect your surfaces. Please, please, please disinfect your surfaces. Okay. Okay, so if you are or you have an employee that has tested positive and they've gone through their isolation periods and now they want to return to work, we recommend that they use the symptom strategy. This is simply you go through your entire 10-day time plus 3. Those 3 days should include, they have to be symptom-free, and they have to be symptom-free without the aid of medication. Okay, so if they have gone through that and said, hey, I'm ready to return to work, at that point, they are no longer contagious. There are some people that are asking for testing to occur again and asking for them to have a negative test. The CDC is not recommending that. As of July 20th, they said to not use the testing strategy and to simply focus on the symptom-based strategy in order for them to return to work. Once they return to work, just make sure you continue your prevention efforts as we discussed earlier on. That is all I have for me. Christine, I'm gonna let you talk about more of testing.
Yeah, so just a little bit more on that testing strategy. A couple of the tests that are available, one of them is the PCR or swab test. And that test looks for the RNA of the virus. And the reason that the CDC has sort of shifted the way that they are doing the release from isolation is because the RNA test can't indicate whether a person is infectious or not. It just simply looks for evidence of the virus. And so you can have an individual who may not be infectious, but still has, we'll use the term RNA residue within their nasal passages. So they have determined through testing and through data and information that the 10-day isolation period plus resolution of symptoms, as Lakia mentioned, is really a strong strategy to use rather than using the test-based strategy to release from isolation. The other test that is available, it is not the preferred method, but it is definitely available, is a serology test. And what that serology test does is it looks for evidence of antibodies within your bloodstream. It can show both active infection or past infection. Some of the information that it doesn't provide to you is whether your past infection indicates enough level of protection that you won't get sick again. And if you get a negative test, it doesn't necessarily indicate that you won't develop disease tomorrow. You could just be in that in-between phase where you haven't developed antibodies and you are in the process of becoming ill. So those are the 2 tests that are available. Both of them are reported into our database, our disease reporting system that Lakia mentioned. And we really do follow up on all of those cases to make sure that everyone has the proper information on how to safely quarantine and isolate. For now, our quarantine and isolation is provided to members of the public based upon simply, you are being asked to do this. In certain circumstances, we can have the executive director of Jefferson County Public Health issue a public health order related to that quarantine and isolation. But we really prefer as an agency to go the education route. We really try to work hard to educate around the need to quarantine and isolate. And we have teams available to provide the supports that folks can do that safely in their home. So we have a case management group that really connects members of our population who need just a little bit of extra assistance to safely stay at home, to be able to do that through access to how to order groceries. We had a great story from early in the response of an elderly couple that needed to be able to safely get groceries. And so our team talked them through and worked with King Soopers on how to do online ordering. So we really work through, as Lakia said, there's no black and white to all of this. And so we really try to be as human oriented as we possibly can be when it comes to testing and case management.
Excellent. So I'm going to interrupt just quickly for a few people that we've had hop on. For those of you that are just now coming on with us, we have two of our experts from the Jeffco Public Health Department sharing educational information, things you can do in your workplace or your work site to support your employees, especially during this time. Also with employees that might positive, the types of tests that were out there at the very start. So make sure that you rewind this video. At the very start, we did talk about the dashboard that's available, the comprehensive website where you can see some of the stats and numbers. And we've also included a lot of those links already into the comment section of this broadcast. So you can also peruse those later on and maybe digest that information a little bit further. Quick shout outs to Mike, Butch, Rich, and Kira. Good morning to you all. Thank you for hopping on with us. Councillor Seymour made a comment earlier, and this was mainly for the age group of those that are 69. Is it accurate that 90% of those are the deaths contributed in Jeffco?
So if I understand the question is looking at the death rate for those above age 69. And yes, I haven't seen the most latest numbers, but the latest data that I did see showed about 85% of our deaths had occurred in the elderly population. Although as I approach that, I find offense to using that word, but we are seeing a lot of the deaths had occurred. We are seeing a shift in who's becoming ill. So we have seen a shift from that elderly population into our younger age groups as we've opened up and moved and starting to relive, and gain a little bit of that life and vitality to our community. The problem is that we never know who we're exposing if we are positive for COVID and aren't aware of it, or if we have mild enough symptoms. And so while we may be perfectly okay, it's really hard to say how that virus may impact somebody else. And so that's why all of the mitigation strategies that we've implemented come into play to really sort of help control the virus within the community.
And, I have a follow-up to that question about our, our more senior community that has been exposed to this. Are we seeing that that's in facilities, or this is a combination of both in facilities and those that are living independently or might be living out in the community as well?
Yeah, we do see a large number of the deaths occurring in individuals that are living in sort of a facility of sorts, be it, any sort of congregational living scenario. That being said, we are still getting cases throughout the months and the weeks as they wear on and we are into the pandemic grind that are occurring in the population just within their homes and within the places where they are living. So yes, a majority are related to institutionalized settings. And I don't mean that that's what we're calling them, but that congregational living setting. But some of them are still occurring out in the community. We are closely tied to our coroner here in Jefferson County. My office is right above hers. So we have a really good collaborative relationship and share information and data and what we're seeing back and forth very readily.
Excellent. So on that lens, Counselor Seymour is thanking you all for that dashboard he's referencing that is extremely helpful. So it's already proving to be very beneficial to some of the people that are tuning in. It looks like Tina's already started navigating it, and she was asking as it relates to how many deaths have occurred yesterday. Do you know how updated our dashboard is? And maybe that can help address if folks are refreshing and trying to see specific time periods.
Yeah, absolutely. Thanks for the question, Tina. The dashboard is updated. At 3 o'clock, a little bit like a squirrel moment. And I have lots of different emails. So I don't know the numbers for yesterday, but I can tell you that the dashboard is updated every day at 3 o'clock. The caveat to that is that the GIS dashboard, so that very last one that talks about geography, is only updated about 3 days a week, just due to the intense amount of background technological work that I don't even understand that goes on to doing all of that GIS mapping in ArcGIS. So that would be the one dashboard that doesn't get updated daily. Everything else does get updated daily. I will say it's only updated with the data that we have available. So we are seeing hiccups in lab reporting. So lab delays, I think you may have heard about that in the news. We are seeing an extreme delay in lab reporting, which is very challenging from a public health standpoint. I will admit that. So and we are also seeing, as deaths come in and they're reviewed both from a coroner standpoint and from, a state health standpoint, some of that death data can lag behind as those death certificates are reviewed. And so that would be, just keeping in mind, an error of the data for that exact day may shift a little as information changes, but I can say you can be super confident that data from, a couple months ago is really not going to change. I've watched one data point in particular. That was the day where we crested into that variance level of concern. And that number is bounced around by about 5 as addresses come in, and we know that we now have a case that belonged to Jefferson County, or we have a case that might have been right on that weird border. I think Westminster, Broomfield, we have some weird areas of our county where one side of the street is one county and one side of the street is another. So as more of that work happens, some of those cases bounce around just a little bit. But it's really hard because people want exact numbers. And for a while, it's just really hard. And so we do a lot of educating as to where those numbers are coming from and why they're bouncing around a little bit.
Absolutely. Thank you for answering that. I hope that answered your question, Tina. Jason, Gink, Mandy, Larry, Godwin, and our board chair, Brian Dice. Good morning to you guys. Thank you for hopping on here with us. We're in the question and answer session. So if you have questions or thoughts for our public health department in Jeffco, please type it into the comment section of this broadcast so we can get to you. Jerry's asking, and this is a question that's valid, right? So when you look at select industries, right, we have different parameters, different guidelines for different industry. If we look at our restaurants, for example, when you're sitting at the table, if you're eating, you can have your mask removed. I.e., that's an example. But leading up to a similar question that Jerry's asking, which is, why are employees asked to wear masks, for example, if they're sitting at their desk? So they're at their desk by themselves, or they might be right there for 8 to 10 hours. They're not moving, and they're at that 6 feet socially distanced. Is there what's the justification behind that, or help us in understanding this requirement that's there?
Yeah, thanks for the question, Jerry. And I think I know some of the information behind that a little bit. So it's very challenging with this pandemic because we are watching science happen in real time. When you go to school and you pick up your science book, you are seeing decades worth of research that have been combined into one document. And so with this pandemic, we are seeing science in real time, and science is not easy. And if science is static, then we as scientists are not doing a good job. And so as it relates to the masking, the best available science that we have shows that COVID is spread via aerosolization, which means those tiny, tiny particles that are coming out of your mouth, whether you're simply sitting at your desk and breathing, or if you're giving a presentation like myself. I am a hand talker, and I would never want to be in front of someone in my current state and in this pandemic without a mask on giving a presentation. So I'm in an office with 4 walls, a ceiling, and a door, doing this presentation without a mask. I would go with, it's the aerosolized particles. That's the best available science that we have. And so even if you are 6 foot distanced and you're sitting there breathing, you are breathing the same air for 8 to 10 hours, and it is going up into the system. That is what I have. That's the best I can give you. I know it's uncomfortable, and it's not fun, but it's what we have for now is the best tool to control disease.
Excellent. And then on that same note, we mentioned earlier how we can try and prepare our workforce for maintaining health and safety by washing their hands and keeping that distance. And then those that are being tested, if they come out with a probable result, if they're coming out with specific, you're asking them to quarantine for those 14 days. So along those similar lines, we have kind of a 2-part question. I'm only going to display one of those, but I'll read you the first one. And that's what happens if they don't quarantine. And so the follow-up to that being, are there civil or criminal penalties if they don't quarantine? So again, talking about those tests, the availability of the tests now, and employees maybe testing, not necessarily fully testing positive, but testing to the extent that it says probable or the lesser of the two. What are the ramifications if they don't take the precautions to quarantine themselves for those 14 days?
Yeah, thanks for the question, Tina. I think I spoke a little bit to this, but I will definitely add on to it. There is always the option of civil or criminal penalties if an individual chooses not to quarantine. We really take the route of one-on-one education to emphasize the reasons to why we are requesting that. I will always stand firm with understanding the why is super important to motivating folks to want to make a change and to do what we're asking them to do. There is always the option. We have not gone that route as far as quarantine and isolation orders within the scope of our pandemic. We issued ballparking maybe 5 written orders at the very beginning of this, before it became before we had more cases where we didn't quite know what the spread was going to look like. We issued public health orders so that folks had a written document signed by Dr. Johnson that stated the request and the state statutes behind it. And we have not done that. We really just issue them an emailed document that states that they are being requested to stay at home. And it's it's hard to monitor 580,000 people. So we really go the education route. Like, we really have that as our mantra, and just that is what we do, and that's what we hope for.
Absolutely. Bob Briggs, good morning to you, and Parker Brown, thank you for hopping on here with us. If you have comments or questions, please type them in as we're in that comment section of this broadcast. This question comes to us from our board chair, Brian Dice, and I know it's semi-covering you up, Christine, so I'll do my best to read it, rephrase it, and then I'll pull it off so people can see your lovely face. He is asking, we're hearing a lot of emphasis on the number of new cases that have shown up as a result of those tests that are going on, or maybe the delay that was there now that they're coming back. But he's also saying that it seems the number of hospitalizations or deaths is not increasing at that same rate that the new cases are. Is that what's really, is the data actually reflecting what's going on, or is this a misread? He's asking on his part, but really as total, if you're looking to compare the new cases in comparison to those hospitalizations or death rate. So I will turn that over to you and take that off.
Yeah, thanks for the question, Brian. to speak to the rate, I think that's a key word to use there. We are seeing an increase in the numbers of hospitalizations, and it mirrors very much the rise in cases that we have seen across the county. So those numbers are increasing, but the rate at which they're increasing, you are correct, is not as great. What we are seeing is folks are seeking treatment from their primary care providers much earlier now. Before, there was sort of a fear of going out and seeking medical care because you didn't want an exposure. And so we've worked hard on a public information campaign to really encourage folks to get out and seek care and seek testing much earlier. One of the other things that happened is early on, when we had a limited availability of testing, we were only testing the super severe cases. And so it would be a natural, alignment that a more severe case would have a more severe outcome. But as testing has become more available, we're not seeing as many of those severe outcomes, even though we are seeing severe outcomes. And it's really hard to predict, if I go out and expose somebody, what's going to happen to their body with coronavirus as compared to others. We have several cases where members of their families have become sick with simply, a runny nose, while one of their family members is hospitalized with COVID pneumonia. Same household, same level of exposure, and a myriad of results related to that disease.
Excellent. So I'm going to ask you a question before I take up Parker's. This question came to me the other day, and in researching, so I am sure other people are interested in knowing this, and you highlighted this a little bit with some of your community specialists that you have. Seniors that are looking for support, and not necessarily online ordering, but looking for the support of Meals on Wheels or those types of delivery. Does Jeffco have those support programs available for residents to be aware of?
Yeah, we have a huge community needs task force that's a collaboration between Human Services, Jefferson County Public Health, and then the Jefferson County EOC. And that whole group has been working together to combine all levels of resources needed for the community. There is a task force related to food access. There is a task force related to targeted testing efforts. And so those resources are available. If the individual is a case, they are connected obviously to a case investigator. But if they are just a member of the community and they are in need of resources, if they call the health department, we've got a whole liaison triage system going where we can kind of make sure that that community member gets connected to the right resource or the right person to meet the needs of that resource.
Excellent. So we will take this question up, and then we're almost near a 45-minute mark, believe it or not. This question comes to us from Parker, and Parker, for just for your knowledge, is on the Jeffco side, is a restaurant operator and owner that's here, and so he's hearing that there may be talk of shutting down restaurants again. Is this a rumor, or is this just or is it factual? I think this really parlays off of discussion about variants and that it might be rescinded, and what would that look like if it were. So can you speak to the validity of this statement, or as a whole, if it's not valid, what people should know?
Yeah, thanks for the question, Parker. Your comment about just another fun rumor kind of made me chuckle, I have to admit. So part of the variance that would be rescinded would affect restaurants. Restaurants would not be shutting down, but the numbers of folks involved or being able to be in a certain space within the restaurant would have to be shifted a little bit. We are working hard on the mitigation plan with the masking and the public communication, the contact tracing, and the education component. It's really hard because some of the cases we're seeing are just related to the community, just doing community things of interacting with each other. And it's not necessarily related to a restaurant. But that being said, your rumor is not a rumor. It is going to be impacted if the variance gets rescinded, but the restaurants will not be closed down. I think that's the one piece that we can kind of toss out the window.
Excellent. Thank you so much. So we are near our 45-minute mark. As I start closing out, I just want you to be aware of a few things. If you entered this broadcast a little bit later, you can always rewind and rewatch if you found this beneficial and know other people that should be aware of some of this education or information and question and answer session. Please be sure that you share it. Quick shout out to Denny and Jason Ganal. I saw you both snuck on here to watch this broadcast as well. And then, as you're aware, we come here every day at 11 a.m. So we'll be back here tomorrow at 11 a.m. featuring a nonprofit partner, which is our Jeffco Public Schools Foundation. Please be sure that you come back then. If you end up watching this video and it's not live, and you give us that hashtag replay so we can know that you tuned in and found this to be beneficial to you as well. So make sure that you comment on this broadcast later on. And then if you think of a question or comment, or maybe you already had one, but weren't comfortable to post it out and have it displayed, you can always DM us that question, email it in, or comment later on, and we'll be sure to get that answered for you without having to feel singled out for whatever reason might be. So again, we'll be back here tomorrow at 11 a.m. And your clue for today is the word is. So if you've tuned in with me starting Monday, I told you that there'll be clues given that connect into a phrase. And at the end of the week, you'll have a full phrase to post next week for me to see if you've won a prize. So watch the Monday broadcast for that word. Today's broadcast word is. Okay, I know. 2 words. Or 2-letter word. And then Jerry, I saw your comment. For those of you that are not aware, Jerry is the county treasurer for Jeffco. They've been making some efforts to working with property owners on taxes and things of that nature. So if you're interested in that support and questions related to it, find Jerry and his team as well. But I want to thank everybody that's tuned into our broadcast. And also thank you, Christine, and thank you, Lakia, for spending some of our morning with us, answering those questions that were thrown your way, and also sharing some of the resources that are available. We truly appreciate that. Have a good day.
Thank you.